The most common form of menopause is a natural transition that occurs in a woman's life, usually somewhere around the age of 40 up to 58, but on average it occurs at age 51. And what happens is, as a woman ages, ovarian function starts to decrease and the ovaries stop working. So estrogen falls and a woman eventually no longer has a period. And so menopause is marked by that final menstrual period. And she no longer has menses for at least 12 months. We call her postmenopausal. But in general, the classic symptoms of menopause are hot flashes, night sweats, sleep disturbances. Sometimes it's difficult to sleep at night, and often mood changes as well, like anxiety or depression. Some of the other symptoms that they may notice are dry skin or hair and nail changes, and even dry eyes. And they may also notice a change in weight distribution. So a lot of women will complain that they are gaining weight in their belly area, and that can be frustrating for them. Hot flashes occur when estrogen levels decrease to low normal or below normal levels. The mechanism is not fully understood, but a lot of research done in this area lately has shown that there are neuropathways involved in the brain that regulate core body temperature. When estrogen levels drop, there's a neuron called the Kindi neuron that gets overly stimulated, and the estrogen is absent and not able to balance that. And so it ends up leading to flushes and hot flashes. Hot flashes can occur, most typically, they're most intense that 2 years leading up to the final period and then up to 2 years after. There's hormonal and non-hormonal therapies for hot flashes. Hormonal replacement therapy is the mainstay of treatment. It is the gold standard as long as a patient is a good candidate. It's important that a comprehensive medical history be taken on the patient so that the provider can understand if there's any contraindications to taking hormone therapy, and that may include cancer, high blood pressure, heart disease, or liver disease would be reasons you might want to hold off on taking hormone replacement therapy. And then the non-hormonal therapy, there's prescription therapy like antidepressants that can help reduce hot flashes, as well as gabapentin, oxybutynin. Those are common medications used in this patient population that also happen to help hot flashes. There's a great drug on the market, came out recently this past summer, called fezolinetant, and it acts on that neuron I was talking about, the Kindi neuron, to help reduce hot flashes. And so that's a really promising drug that's come out for us to be able to use that's non-hormonal for breast cancer patients and other patients that cannot take hormone therapy or prefer not to take it. It can feel like forever because it can last for 7 to 10 years actually, but thankfully, hot flashes do stop at some point, and some women will only have them for 1 to 2 years. About 15% of women who go through the menopause transition won't have any hot flashes at all, but the majority will, and they just have to hope that they're going to be one of the lucky ones where it's only a few years and not 10 years. But it is common for it to last for quite a while. It won't last forever though.